Good morning. So often throughout this process, I've spoken about the fact that statistics matter and they're important, and we spend a lot of time talking about statistics, but in reality, what we are talking about is people. And we're talking about people we care for, people in our community, and every person has loved ones, has family, has people who are so involved in their lives. And we try to always report everything we discuss in our organization as people we serve, people we care for, and that people who we are returning back to their lives. Behind every person that we care for are the team and the people who are caring for them. So I'm delighted that we're celebrating, and we will be making an announcement over the course of this weekend within Hartford Healthcare, that in the month of May, we are declaring as Hartford Healthcare Month. And what that means is it recognizes and it celebrates that healthcare is a team sport. And we have three really important traditional celebrations that occur in May. First is Nurses Week, which is occurring this coming week, beginning Monday. Secondly, May 14th is Hospital Week, followed by the third week of May, which is National EMS Week. So what we've decided to do is we will celebrate each one of those weeks as we traditionally do, very significantly, recognizing all of the essential people on our team. But over the course of the month of May, we are going to be recognizing all people who work within Hartford Healthcare. And what we have done to bring more attention to that and to bring more recognition to the people who are caring for the people is we have engaged a local Connecticut-based documentarian who we've given access to behind the scenes. And he is doing short 2-minute documents that we will now be able to bring forward, and you will see the first of that today. So we're excited to be able to bring these forward. We think it's going to bring great attention to the absolute heroic work, the incredible teamwork, and the incredible diversity of people and skill sets that come together that allow us to do what we do each and every day for the communities we serve. This was a really important week across the state, and particularly at Hartford Healthcare. We're so delighted with the mobile testing that we were able to stand up. Going first in the city of Hartford with our mobile testing and doing the open hearth homeless shelter and being able to do testing for every member of in congregate in that shelter, as well as every staff member, was an important step forward. We also applied the mobile testing to a full nursing home, both of all the residents and patients in the nursing home, as well as the staff. And we will be now deploying it next week, nearly each and every day, to different communities throughout the state. We stood up permanent testing sites in Avon. Westport is opening today. Mystic and Newington are following shortly, as well as Enfield. So we're dramatically expanding our testing as we're working to bring as much testing available and accessible to the communities that we serve. So what I'd like to do now is to bring this forward, this first documentary that you can see. And this highlights a nurse, Sophia Sopczneski. And Sophia is coming to us from the Hospital of Central Connecticut. She's been a nurse within Hartford Healthcare, or a member of our team since 2008. And Sophia is born and raised in Connecticut from Terryville. And one of the interesting dynamics, if you look at her personal career path and trajectory, is she began in 2008 working as a tech within our team, and then evolved and went to UConn for nursing school, then was a floor nurse, and then shortly thereafter, about a year and a half being a floor nurse, stepped up and advanced into critical care nursing. So Sophia is a wonderful example of a person working on the front lines today, doing absolutely exceptionally important work, who was trained to do this. It's her passion, it's her interest, and she gives wonderful perspective. So what I'd like to do is share this video and then invite Sophia to come forward and answer questions directly for you. Please.
Good morning.
Good morning. How are you?
Good. How are you doing?
Good.
We get screened every morning to make sure that as we come into the hospital, we're not bringing, any potential issues with us. I'm gonna kind of set my mind for the morning. I can't be sad or tired. I'm not gonna think about family and friends. We're gonna just leave that behind for now. So it's an honor to care for all of the people that are struggling through this pandemic and to have such incredible coworkers, doctors, PAs, NPs, CRNAs, nurses. I work with an amazing group of superhuman people, and we are a family here. For us here now, the impact of COVID, it's very difficult. I had a patient who we took his breathing tube out, and he woke up and the first thing he said was, "I miss my wife so much." And we called her and she was so excited to talk to him. So to be able to be there in those times, just know that we're here. Since we're getting closer, I want to just take a minute in silence to honor all the people that are struggling through this, those that have lost their lives and those that are fighting for their lives. All right, here we go into the unit.
So I think when you see this documentary, you really get a full sense of what it's like, and it's a really good vision of what's occurring behind the scenes. So with that, I'd like to invite Sophia to come forward, answer questions for you, and give her perspective. And we really thank you for your willingness to grant us access and to be part of this process, and for everything you do every day.
Thank you.
Can you share some thoughts after seeing that?
Sure. You know, first I just want to say it's an honor to be here to represent the ICU from HOCC. Like Jeff had mentioned, I've worked there in the unit itself for 8 years. And, you know, this whole pandemic is like nothing I ever could have imagined going through nursing school. And, you know, regularly ICU nurses and our ICU team as a whole, we're pretty tough people. We can handle almost anything. But, you know, what we've seen through this pandemic is like nothing we could have ever imagined. So, you know, watching that video play back, it's very touching. It's the reality of what's going on. And, you know, the most important thing is it's been difficult, I know, for families and patients to not have their family members there with them, and it's been difficult for us. Know that we have become their family. You know, we've invited them into our ICU family, and we keep very close eye on them. We spend extra time with them. We go in just to give some smiles. When we walk past the windows, we give the thumbs up. We make sure that they're smiling and they're doing okay, the ones that can. So, you know, we're gonna make it through this, you know, one day at a time. We've got this.
Any questions?
Does anyone have any questions?
Does anybody have any questions?
Hi, this is Danielle with WPIC. I was wondering if you could just give us your personal thoughts and feelings on seeing hospitalizations go down in Connecticut. And I know it's still too early to say anything, but you know, we are seeing this gradual decrease. So wondering if you had any thoughts on that.
Sure. I think, you know, seeing the numbers go down is encouraging. It's very hopeful for us. You know, it's that our community is doing well, that everybody is listening to the guidelines as far as social distancing and being sure that you're being conscious and aware of those around you. I think it's hopeful. I think that we also do need to keep our guards up, make sure that we're still doing the things that keep us safe. You know, we all want to get back to normal life, and you know, we may potentially be looking at a new normal, but that's okay if it gets us out back doing some normal things. So I think that we just can't drop our guards. We need to remember to be safe, follow all of the guidelines, and you know, it's very hopeful. We're looking forward to, you know, moving on to the next phase of this.
Thank you.
You're welcome.
Hi, it's Bridget from the Republican. Just wanting to know if you are noticing what seems to be the statistical trend in a high number of patients coming from nursing homes.
You know what? We have seen quite a few patients coming from nursing homes, but I think in anticipation of those numbers, our network, our hospitals have done a great job of identifying those potentially troublesome areas and doing what we can to coach and mentor those nursing homes, you know, how to stay safe, how to keep your staff safe. We have all become a community in Connecticut, not just, you know, Hartford Healthcare, but as a whole, to do what we can to try to make sure that we're keeping each other safe. So, you know, we do, as we receive the patients from the nursing homes, we make note of that. We're tracking it very closely, and we do our best to make sure that we're keeping everyone safe.
Thank you.
You're welcome. Does anyone else have any questions?
This is Emily from The Current. I have a more generic question about mobile testing. I believe you said that the mobile testing unit had tested an entire nursing home, patients and staff. Which nursing home was that, and how many residents and staff were tested there?
Yeah, this is Jeff Flaks. The nursing home in particular was the Jefferson House, which is in Newington. And we tested it the middle of this week. We actually have a few other nursing homes we're planning to go to in the near term that are on the docket. But we tested, I don't have the precise number, but it's in the range of 100 some odd patients plus the staff, all the staff who worked there.
And can you tell me a little bit about why you're testing entire nursing homes at this point?
Sure. Well, in this particular case, it's a nursing home that's operated by Hartford Healthcare. So as we've developing our testing capability, we were in this trying to understand if there was any penetration of COVID-19 and to make certain that we had a good appreciation for where we were. So it was in the early stages of testing, it was a good opportunity to focus on that population, and we're going to see what we learn from it.
Thank you, Jeff.
I want to thank
Again, I want to ask one more question for Sophia.
Yeah, please. Sophia, please.
Thank you for this. Could you just give us whatever else you could about like who you are, where you were raised, how old you are whatever you're willing to tell us about yourself personally?
Yeah, I could go on for hours, but so my name is Sophia Sopczneski. I grew up in Terryville, Connecticut. It's gonna make me teary-eyed because it's a small town and I'm very proud of being from there. So anyway, I grew up in Terryville. I went to UConn for nursing school. And I graduated year of 2010. So I started on a med-surg floor, like Jeff had mentioned. I worked there for about a year and a half. And then I transferred down to the critical care unit at HOCC after that. So I've been in HOCC ICU for about 8 years. You know, it's a place very near and dear to my heart. Like I said, we are a family, and regularly we function as a family. We're dysfunctional as a family. So, you know, we've come a long way through this pandemic. We've worked long, hard hours together, and you know, it's one day at a time. To answer more of your question, I'm 32 years old, so you know, I still have a lot of years ahead of me. So we'll see how we get through this one day at a time. Did I answer your question?
Yes, thank you. Do you have children?
I don't have children. No, I have two fur children.
Thank you.
You're welcome. Any other questions? I'm going to turn it over to Jeff.
Thank you, Sophia. You know, I invited Sophia here today, and we're doing these documentaries because we want to put real people behind, you know, the faces and what's being discussed in terms of healthcare heroes throughout Connecticut. And when you see Sophia, this is a healthcare hero. These are the people who are on the front lines who are battling COVID-19, and you get a sense of who they are, how it affects them, type of sacrifices and commitments they're making, the empathy they have, the excellence and expertise they have. It's absolutely amazing. When I round and I have a chance to be within our facilities, you know, Sophia is representative of thousands and thousands of people who work in healthcare today, and it's absolutely amazing. I also want to make one concluding comment, because Sophia made an interesting statement. She said, when we return to normal. And I've been talking about this now since the beginning of this process, as we've seen progress we're making during COVID-19, I don't want to see us return to normal. We're going to be better than normal. There's so many lessons we've learned in this process. We're seeing emerging new capabilities like digital health, the amount of telehealth visits we're doing. That's a whole new way to create better access to care, better than ever before, and new ways to care and treat people and make our services more available at all hours of the day and be culturally sensitive and do all types of things we couldn't do under normal circumstances. I look at the way our staff are able to help patients and be ambassadors for them, and the way we're using technology to FaceTime and bring families from near and far into the room to see our patients and talk to our caregivers. It's wonderful advancements. So there's so many examples. I look at the way we're just accelerating the number of pilots we're doing with medications and the way we're accelerating new technologies in finding better ways to do things more quickly and more innovation and experimentation. So when we emerge from this, and as we emerge from this, there's going to be a new normal in many ways, and it's going to be better, and we're going to keep getting better. So I thank you for your time today. I'm excited during this Hartford Healthcare Month that we're going to keep bringing forward people like Sophia. We're going to keep bringing forward and releasing these documentaries, which I think are going to be wonderful opportunities to have a vision into what it really is happening behind the lines when it's so difficult to grant access, understandably. So again, thank you for being here with us today and for everything you're doing to report on this really unprecedented set of circumstances. Thank you so much.